We'll also brief you the updated information regarding COVID-19 situation and answer some of your questions. With us, we have Madam to Madam Wu. Friends from the media, good morning. 260 new confirmed cases is reported on 1st of April and 6,051 asymptomatic cases. Among 268 found in the quarantine places, 250 screened out in NAT testing among targeted groups, 2 transformed from asymptomatic cases. Among 6,051 asymptomatic infections, 5,402 found in a quarantine place, 649 cases found in a testing among the targeted group of people. You have noticed that the COVID positive cases reported also is increasing because that we screened and tested a larger scale of population. Right now, we're still in a critical moment to curb the spread of the coronavirus. For the first round of the closed-off management, also issued announcements. So they also practiced a tiered style management. The closed down area is the people not going out. And also for the control area, the residents are not leaving their compound. So we call on everyone to pay notice to your COVID-19 environment at your local areas. 130 cases male and 130 cases female. Pudong new area, 79 cases. Minhang district, 57 cases. Xuhui district, 37 cases. Songjiang district, 19 cases. Putuo, 13 cases. Yangpu, 11 cases. Jing'an district, 11 cases. Baoshan district, 10 cases. Jiading, 9 cases. Huangpu, 5 cases, and Jinshan, 3 cases, Hongkou, 3 cases, Fengxian, 2 cases, and Chongming, 1 case. For the above 260 patients right now treated by a group of experts based on their clinical symptoms, the imaging results, and the lab tests. Right now, these 260 confirmed patients is the mild symptoms of COVID. Regarding 6,051 asymptomatic patients, and you could learn more details on our official account. These 6,051 people is confirmed as the COVID-19 positive based on their epidemiological investigation, clinical symptoms, lab testing, and imaging results. And these 6,051 people are confirmed as the asymptomatic carrier of COVID-19 virus. As of 9 o'clock this morning, the accumulated residents over 30,000 people, close contacts, are now under the quarantine. And right now, they're the testing, so waiting for the final confirmation. And 70,953 are the general direct contact. More than 60,000 people showed negative to COVID. And the rest are still waiting their COVID results. For the western side of Huangpu River, right now this round of testing is even larger and wider. So the situation is more complicated. We make sure that each and every people is tested with no one left behind. As of 12 a.m. yesterday, and the first round has tested 14 million people. Right now, the results are still underway. For this round of testing in the western side of Huangpu River, will ongoing. So people stay at home, work from home, and when you're waiting in line for testing, please wear masks, keep social distancing. No public gathering, no talking, no smoking when you're waiting for your turn to get tested. So we will do everything we can to avoid a cross-infection. Thank you very much. Now the floor is open. Please identify your media affiliation before asking questions. With paper. My question regarding the close of management in the western side of Huangpu River, and right now the tiered management still also practiced in the eastern and southern side. So my question regarding whether there's a special channel opened for the patients to receive the hospital service, especially for dialysis and lying-in women. Regarding the hospital service availability in the closed-off management region, we talk about the OD emergency room actually is open to the public. And we also have the clinics available in different compound. So we have a specific work team and contact person to provide access to the hospital service. For the people waiting for dialysis service, and also the lying-in women, and also for other a regular hospital service needed patients, the different locality volunteers have learned the picture, and we have a working scheme in place to learn the needs and to try our best to provide a service between patients and hospital. As you mentioned, that for the patients with a serious disease, and it's called the 120, and also to contact your local medical staff. And the chartered vehicle will be provided point to point to transfer patients to the designated hospital. For radiotherapy, the patient for dialysis treatment, they can visit their frequently visited hospital if because of the closed down management, and they can visit a nearby hospital institution. For lying-in women, also will be transferred to the designated hospital in their compound. We talk about the designated hospitals actually are selected as the comprehensive hospitals with a high capability. For the patients with chronic disease like high blood pressure and diabetes, and we also to learn their prescription needs, and we will bring their needs to the nearby drugstores so we can bring the drugs to their doorstep. Xinmin Evening. My question, also Madame Wu, how we can better improve the online hospital service to people, and also people may have a complaint regarding the slow delivery of medicine after they visit the online hospital service. As you mentioned, the role of the internet hospital played a key role. And right now we have issued a set of a license to the online hospitals covering the large hospitals and also the clinics and the community clinics. We have seen a surge of hospital service needs by 50 to 80%. Under this circumstance, we also add more headcount to the internet hospital, expanding the service hours and also the scope of service. On top of the regular outpatient service, also have the specific department service and also the experts outpatient time. And also we have added more headcount to deliver the drugs. We have also established the supervision team to monitor the operation of internet hospitals. As you mentioned, after visiting the online hospital, and they need a third party to deliver a prescription. Because of the strict COVID-19 precaution measures, sometimes it takes a longer time to receive the medicine. So we also ask people to use the community level based inquiry platform, so which means that if you have the need for a prescription and you can report to the local community leadership via this platform, and they will bring your need to the designated hospital. So we have this kind of a dual mechanism in place, make sure that the people can get their medicine and hospital service in need. My question to Mr. Zhang. A question regarding not how you help the people in the special needs, especially the elderly people living by themselves. Shanghai is a city with a high aging population. The care and the support to the aging people is also top of our agenda. In the recent days, the civil administration at different levels paid great attention to the people, especially elderly people living by themselves. And we contact them via phone or via chat to learn their situation and also help them to register for testing and also to deliver a daily necessity or meals to them. And also the volunteers also make phone calls to their paired people. So provide care and assistance to the elderly people. And regarding the needs for the elderly people, for the daycare service during the lockdown period, also will be continued. And we also leverage the role of the aging network to learn the dynamic situation and information about the elderly people in different compounds. And we also have the platform operating around the clock to receive phone calls by the elderly people or their relatives. And we will also bring their difficulties to their community leadership for further solution. They also rely on the local community leadership, the volunteers, to give support to the elderly people, and also call on the residents to also show your love and care to your neighbors, especially the elderly people. And we will continue to improve our mechanism and also to make response to the people, especially to meet and resolve their urgent needs and problems. As you mentioned, the gardens for the little ones. We talk about if the parents with COVID positive could, or the close contact could be transferred to the quarantine place, so no one take care of the little ones. So if this situation happened, then a local community in charge of children care should pay the responsibility to make sure that we put the children's life and safety before everything else. For the minors, and we need to make sure that there's a contact person to take care of them. If there's no guardians could find, then the local community should take their responsibility to assign a specific person to take care of the minors. If the minors could not be taken care at home, and the minor assistance agency or institute could assign a person to provide a temporary care. Thank you. If no further questions, that's us for today's Q&A, and we will also keep you updated by releasing more information. And also, if our media friends have more further questions, you can also contact the office. Thank you.